This
which is
conference will now be recorded.
bringing this webinar together. The whole idea behind these webinars was to bring together the experts from the field who are involved in environment and COVID-19 and share their experiences to bust all the myths and fallacies which are there. We are privileged to have with us today Professor Paolo Carrer from University of Milan, Italy, and Dr. Prasad Modak, past president and patron of SIE today. Taking this forward, I would like to thank all the participants who have shown immense support and the response that we have got that has motivated us to take this series with more zeal together. With this, I would like to hand over the session to Professor Arun Sharma, the moderator for today. Professor Sharma is SIE President and Director Professor of Community Medicine in UCMS University of Delhi. Over to you, sir.
Thank you, Dr. Priyanka. Very good afternoon to all the attendees of this webinar, second in the series of webinars that Society for Indoor Environment has planned in order to bring the experts from the field closer to the members of Society for Indoor Environment and other listeners who take a keen interest in our environment. And unfortunately, we are in the middle of a very serious global crisis caused by the disease COVID-19. And we find a very important relationship between our environment, particularly the air, and the spread of this disease. So any information that is relevant, that is important, if shared with the citizens in general and the scientists in particular, are likely to be extremely useful in our fight or again in our battle against COVID-19. So I welcome you all once again. And before we start with our presenters, just a couple of rules I would like to mention, that all the listeners are requested to remain in a quiet mode. That means they should keep their microphones in the switch off mode so that there is no disturbance. And if they have any questions, I request them to type their question in the message box, and we will be directing the questions to the speakers today after their presentations are over. And then we can have an open house discussion also if time permits. Having said that, let me take this pleasure of introducing our first speaker, Professor Paolo Carrer from the Department of Biomedical and Clinical Sciences at University of Milan, Italy. He is a renowned global personality and really needs no introduction because of his immense nature of work and the amount of work that he has given. Nonetheless, it will be my pleasure to read out to you who's who of Professor Carrer. He is the director of the Occupational Health Unit at the University Hospital ASST Fateben Fratelli Sacco Milan. He is the director of the Postgraduate School of Occupational Medicine, University of Milan. His teaching activities are in the field of medicine, prevention techniques and safety procedures in the environment and workplace, sciences of prevention at Postgraduate School of Occupational Medicine. His research interests have centered on indoor and outdoor air quality and related health effects, health risk assessment to chemicals and risk evaluation and prevention in hospitals. He has served as chair of the Scientific Committee on Indoor Air Quality and Health of the International Commission on Occupational Health, and he has participated in expert groups on indoor air quality of WHO, International Labour Office, European Union, and Italian Ministry of Health. I welcome Professor Carrer and thank you for accepting this invitation to join this webinar. I extend the thank on behalf of Society for Indoor Environment. Professor Carrer, please, for your talk.
Thanks for this invitation. I'm very happy to be here and to share with you the experience in this very, very dramatic moment. Now I will upload my presentation. I have to ask you to give me as a speaker in order that I can upload the presentation. Priyanka, sorry.
Yes, Paolo. Yes.
I need to be assigned as a speaker in order that I can upload and can share.
Yeah, I'll request Professor Sharma. Professor Sharma is on mute. Just a minute, sir. Hello? Okay. Okay, sir. Okay, sir. So how do I make him?
Thanks for this invitation. It's a very, very dramatic moment in all the world, in Italy, in India, everywhere. I'm working at the Luigi Sacco University Hospital that represent in Italy a center of
Sir,
excellence
उनको
for
presenter नहीं बने अभी. He's not.
for healthcare activities related to biological risk. And we were the first hospital in Italy involved in this coronavirus epidemic due to our expertise. And in just 2 weeks, we were able to have to treat more than 300 patients, so a very, very huge number of patients. So I would like to share with you some information about this virus, some principle of prevention that we have performed, also learning day by day how to manage this virus, and with the focus on the healthcare workers. In Italy, we had in March a very in 2 weeks we had more than 6,000 patients, so a very, very huge number of patients. And now we have more than 236,000 of patients with about 35,000 of deaths. So very, very dramatic. And many of these are healthcare workers. So it's very, very important to have highly prevention in our hospital.
Paolo, your slides are there. So now probably you can use the slides also.
Okay.
Thank you.
Okay. And to this one. Mm-hmm.
You know when I have to change the slide?
And to move the slide.
Yeah, which one, sir? I'm sorry, I missed out because there was a power failure here. Which slide number should I go to? Is this okay? Next one?
Next one, okay.
Yes, sir. Is this the one?
Next one.
Yeah.
No, the next, please, the next. Here we, okay. The next one, please. So this is a very particular virus with this envelope, this very strange envelope with these spikes, so the normal coronavirus, and is causing a severe acute respiratory syndrome. Next one, please. The transmission is primarily through the respiratory droplets. First one, contact with the infected person, affected patients through coughing, sneezing, and to have very close personal contact. But it's very important also the contact with surfaces. So we have to pay attention not only at the person, but also at the surfaces. We learn that also people that have not yet developed symptoms can be contagious. And so we have to pay very attention and not to focus also in symptomatic people. Sure, there are procedures that generate aerosols that are very highly risky for people. Now, in particular in the indoor science, we are trying to understand if also in the absence of aerosol generating procedure, in any case, there can be some indoor air aerosol that stay for some hours in indoor air that can be infected. And so it's very important, and I think it's important for the indoor air community to look and to learn very well how to manage this indoor contamination. The next one in the hospital, and sure, the problem to protect patient and healthcare worker were very important for us. And what we immediately understand is that the use of the personal protective equipment alone are insufficient to provide an adequate level of protection. So we need a multidisciplinary approach, and in particular, we have to talk to all the people, and they have to understand that the basic concept of the prevention is that everyone has to protect everyone. So we need physical distancing among the people and surface hygiene, and to put a system that is able to isolate at home immediately the infected people. So it's very important to be able to see immediately when a people is symptomatic, and to isolate him and to isolate also the close contact to him. Then there are some recommendations that have to be done at home in order to manage these people. And it's very important, particularly in Italy, to have the possibility to do a particular examen, the nasopharyngeal swab, that is very important to identify the contagious people in order to isolate them. In Italy, we have a national lockdown, as in many countries, with many restrictions on the movement of the person, suspension of public activities, of school, and also some very important rule in order in the activity, the working activities, and the smart working was asked to be increased. In hospital, we try immediately to have the very high prevention. And now, at the end of these 3 4 months. We have some preliminary data, and probably less than 10% of our healthcare workers have been infected by COVID, and just 3% with disease. The other are mainly asymptomatic. What we immediately understand is that there was a risk to be infected in hospital, but at first the risk was out of hospital. So we have many healthcare workers infected in the activities at home, or in any case out of the hospital, that then bring in the hospital the virus. And so we had some infection caused by the healthcare workers to other colleagues or to the patient. So we need an integrated assessment and management in hospital, but also out of the hospital. Only with this whole management we can have some positive result. The first thing we have done was to plan the care activity. So we reorganize the activity in the hospital in order to reduce the number of exposed people. So less worker, but these workers have to be efficiently protected and efficiently able not to be exposed, to reduce the opportunity in the exposure level. And also, this is very important, to reduce the need of dressing or undressing with the personal protective equipment, because this activity is very highly risky for the healthcare workers.
Paolo, we have the slides now, so just let me know which slide to go on to.
Yes, the next one, next, please. Next. Okay, next, next, next. Okay, next, next, next. Okay, next. The next, okay, the next, okay, the next, okay. This is workplace, okay. Now the next,
Fine.
okay. The next, we were the next
On occupational risk.
Occupational risk. The next one, please.
Yes.
These are the number of our hospital. So now we have less than 10% people that were infected, but less than about 3% with the disease. The next one.
Yeah.
The next one, please. The next one. The next one. So here, so what I can suggest is to plan the care activities, to use all the idea you have in order to reduce the need of the personal protective equipment, because you know that there were also some problems in have this equipment, and using this equipment is also, there is also a risk when you manage, when you dress or you undress. So it's very important as indoor people to have an environment with adequate ventilation. All the patients must wear the surgical mask, and the training. Training was very, very important. We spent many hours also during the evening for training people because many workers were not used to treat infected people. They were in other units. So many healthcare workers were moved from one unit to another unit. And so we need to train also during the evening these people in order that they know how to manage these patients. The next one, please. The next one. So personal protective has to be part, and in particular, we need these masks when the risk increase. So when the contact is very close and prolonged, when, in particular, when are present procedure that produce aerosol. These are very, very risky. The next one, please. So limit the number of people and properly ventilate the room, possibly in negative pressure room, in these where the patients are present, in particular when there are aerosol generating procedure. The next one, please. And in these activities, we need the mask at the AU FFP2 standard, at least. In some cases, also we use FFP3, but we don't have so large number of these. So we spent many time in order to plan the activities and to reduce the need of this mask, because there was some problem also to have this one. Use eye protection, ensure also clean gloves and no sterile long sleeve. The next one, please. Okay. Sorry, Priyanka.
Yes, Paolo.
This is come back. So
Okay, we have to go forward. We'll go forward.
Yes.
Move forward. Move forward.
Yes, because we have come back to the first one. So please.
Yeah, we are almost at the end. Yes.
Yes.
We'll handle.
So please, if you go to the end.
Yeah.
Please, if you can go to the end. Go. That's
Hello.
Please, you can go to the end. Okay, this one. So we need very important when we had an infected person and infected people also to do the so-called contact tracing in order to immediately define the other contagious people and to isolate at home. And this was a very huge work in our hospital for so many people involved, but it was very efficient in order to reduce the infection in our hospital. The next one, I will not go. Oh, the next one, please. And we also measure the body temperature at all the workers when they started the work in order to identify very, very early the the infectious people. I would like just conclude with this possible negative effect or lockdown. So we have to balance the reduction of the disease due to the coronavirus, but we have to restart with all the other activities because we know also how huge can be the negative effect of lockdown. So we need to look at the total picture of public health. Just the last one, please. So my main message are here. We need an integrated and multidisciplinary risk assessment management. And at first, we have in hospital, but also in all kinds of environment, to plan the activities in order to reduce the number of people exposed, to reduce the opportunity and the exposure level, and to reduce the need for the personal protective equipment, because also dressing and undressing is very highly risky. So we have to give this message to our people, our workers. Now it's also very important the active surveillance of the physician, particularly in the hospital and in the other working activity of the occupational health, in order to highlight workers with particular fragility. For example, healthcare workers that had some disease, in particularly some immunodepression, were immediately moved and isolated at home in order not to be infected. And the active surveillance is particularly important to define, to look immediately worker with symptoms related to COVID-19 in order that to have isolated and to reduce the infection. And sure, all this attention to the infection have also to be balanced with the effect of the lockdown. So we have to find solution in order to make our economic, social, and also educational activity restarting, working, and not to have another peak of this disease, because this will be very, very dramatic. So these are the main messages from my experience, and thank for your attention. The next one, if you want also to give me some question, etc., this is my email, and I will ask to you. Thank for your attention.
Thank you, Professor Kerr, for your excellent talk. I deeply apologize to you and all the attendees that there was a sudden unexpected power failure in my office. So I got disconnected and the slides could not be presented in a timely manner. And I'm really sorry for that. But in spite of the technical problem, the show must go on. So we'll try to continue from here. And before I start Professor Modak to deliver his talk, I would like to first upload his slides and then I'll go on to the next step. Please bear with me for a minute. Yes, we are ready with the slides of Professor Modak. I welcome sir to deliver your talk. To my attendees, I would like to introduce once again Professor Modak. He is currently the Executive President, Environmental Management Center LLP and Director of eConnect Knowledge Foundation. Earlier, he was professor at Indian Institute of Technology, Bombay. Dr. Modak has worked with almost all key United Nations organizations, multilateral and bilateral developmental institutions, and intergovernmental organizations in the world. Apart from Government of India and various state governments, his advice is sought by governments of Bangladesh, Egypt, Indonesia, Mauritius, Thailand, and Vietnam. He is a member of Indian Resources Panel at Ministry of Environment, Forest and Climate Change, Government of India. He is member of Task Force on Sustainable Public Procurement at the Ministry of Finance. Dr. Modak has extensively published and completed several assignments on the subject of air quality management. In modeling and monitoring network design, he has developed several tools for analysis and interpretation of air quality data. Dr. Modak was founder president of the Society for Indoor Environment. Dr. Modak has published several books on environmental management. His latest book, Environmental Management Towards Sustainability, was released in December 2017 with CRC Press of Taylor and Francis Group. Dr. Modak has been recipient of the Distinguished Alumni Award of AITAA in 2010 for significant contribution to international affairs. And I want to add that we all are great admirer of Professor Modak, and the blogs that he writes, they are really worth reading for everybody. So with that, I invite Professor Modak to please start his talk. Professor Modak, sir.
Thank you so much, Professor, for your kind words. I'm very excited to be here today. I see a large number of people participating. I think we already have close to 60. And I think this is it's a great opportunity to connect with all of you and share some of my thoughts. Um, is it okay, Professor, I tell you to skip the slides the way I speak?
Yes, sir. Yes, sir. I will manage the slides.
All right, but there is no way I can do myself, right?
I will do that, sir. I'll do that for you.
Yeah, because then it will be convenient. I can push the slides from my end. Okay.
Right. Yes, sir. I will do that. Please go ahead. You advise me, and I will change the slides for you.
Okay, fine. So we'll do this arrangement. Fine. Yeah. So I'm going to be talking more, like Professor Paulo talked about the more to the health-related issues and so to say indoor air quality. What I would do is touch upon more of the outdoor situation, the outdoor air quality, and especially in the pre-COVID times and the post-COVID times. So that's going to be my thrust. And in this presentation, I'll take some examples. Some of you have expressed your interest to know what's the science going behind it at this stage. I'll touch upon that as well. Could you push the slides, Professor?
Yes, sir.
Please. Yeah, can you press again? It's been animated. So what's changing if you look at it? And emissions is what is changing. Because what you see pre-COVID, the situation was, then during the lockdown, what happened when we had almost life coming to standstill, and what changed was the composition, the intensity, the timing, even sectorally and spatially, the emissions change while we were in the lockdown. And perhaps we will also see such a change in different ways happening even in the post-COVID period. This is a snapshot of an overall situation, and some of you, and I think if it is possible, Professor, later to share my slides, maybe some of the attendees may like to go to the original references which I've put them in slides were relevant. And this has been a very interesting paper which came out just in the later part of April, so very recent. And using the satellite-based air quality measurements, Uh, this particular paper looked at what's the change happening in countries which have been major epicenters like China, South Korea, Italy, Spain, France, Germany, Iran, and the United States. And what was found that the nitrogen dioxide pollution decreased by an average of 40% over Chinese cities. So there's a substantive fall. And by 20 to 38% in that range over the Western Europe and the US during the lockdown periods as compared to what used to be in 2019. So there is a noticeable fall people did see during the lockdown periods. Next one, please. Another interesting paper which came about, which focused mainly on China, and they looked at now not the satellite images, but the ground level data, which was quite partially distributed to 800 ground level monitoring stations in northern China. And what they found was the particulate matter decreased by an average of 35%. Nitrogen oxides to the order of 60% during the lockdown phases. So China itself will find a very substantive reduction. And remember, the source of data here was ground experiments, unlike to what I earlier talked about was satellite-based observations. But they found that the average surface ozone concentration increased, by a factor of 1.5 to 2% in the same time period. So that's interesting. Next slide, please. The next slide, please. Right. So these are the key references. I think it's worth referring to. Can we go back, Professor?
Yes, sir.
The earlier slide. Yeah. So I would highlight these references in geophysical research letters are worth referring to because they give you a lot of insight about what happened in the data analysis done in China. The next one, please.
Yes, sir.
Yeah, the next slide.
Yes, sir. Brazil.
Yeah, Brazil, correct. Yeah. So Brazil has been an interesting case, and let me take you to the work done there. And they looked at again the ground level measurements, but you would notice a very high decrease in CO, NO, NO2, and as I was saying earlier, what they observed in the case of China as well is about 30% increase in this case in the ozone concentration. And this is again, I would recommend as a very interesting, research paper to follow what's happening in or what happened in Brazil. Next one, please. The next slide.
The increase in ozone concentrations.
Yeah. Now the question comes in both the cases we saw in China as well as Brazil. And so also this has been found in the work done in India by Sharma and co-workers that you do see increase happening in the ozone concentration because that is actually associated with a decrease in the NO, which as you know causes decrease in ozone consumption. So therefore you do see, and that is quite expected to see higher ozone concentrations. But note that when that we speculate about, ozone forms complex reactions, right, involving nitrogen dioxide and VOCs as well. And the ozone levels are also quite function of the weather conditions and other factors. So we may not be entirely able to attribute, but certainly this kind of an increase in ozone level was expected and it is being observed. Next slide, please. So surface ozone, remember, can cause severe health problems, including pulmonary and cardiac diseases. And this is something which has been quoted. There is a lot of work been done on this area. But of course, this high or higher values of ozone have happened only in the phases of the lockdown where the nitrogen concentration, dioxide concentrations reduced. Next one, please. Now, you saw earlier use of satellite imageries, which was made, in the study, which was more pan country or global level. But this kind of work was also done in Brazil, since we are talking about the Brazil case here. And here is you'll find the outcome of the application of or analysis of the satellite imageries. And this has got an advantage of a large spatial sweep. And there you see again a significant decrease being observed, especially when it comes to the NO2 concentrations post, in the lockdown period especially. And you see when the partial lockdown came about, that phase, the concentrations rose up than what they were earlier. So you do see satellite images capturing. The next slide, please. So this is a next slide, in fact, is going to show you, it's a slide you can easily read, but if you look at the, get a chance later on to look at these images closely, you would see the difference between February 25 and March 24 in terms of detection, the way the spatial distribution was there in the NO2 concentrations. Next slide, please. A good work has happened in Delhi, and this is the work recently published by Susanta Mohato and his colleagues, where they use ground level data, 34 air quality monitoring stations, and interesting observations again matching to others, but it actually brings you to the notice that there was a sharp fall immediately in the very early stage post lockdown when it started. Interestingly, they use air quality index as a surrogate measure to compare the situation before starting the lockdown and after the during the lockdown. And noticed also that there were spatial variations in terms of improvements in air quality expressed in the form of air quality index. Next slide, please. So you would see the slide which is coming up now, that spatial distribution which they mapped on the air quality index does show you for different days how during the lockdown period the spatial variation in the air quality was changing. They aggregated, as you see in the slide, the way we defined air quality index in terms of different pollutants. The intent of the slides is to show you that there is when you see decrease, the decrease is happening differently in different locations of the city. Next slide, please. Let me take you to Rajasthan. And the Rajasthan Pollution Control Board, I would say, has been very, very enthusiastic. They did good amount of work and published on the web a comparative between what was there before the lockdown and during the lockdown. So there have been already a lot of posts done by the RPCB. So let me look into what findings they had, and also some work which I thought that we could do using their data. Next slide. Now here what you see is a pattern they found in, I mean, they done for all the cities there, I mean major cities. I've just picked up Jaipur and Bhiwadi and Udaipur and Kota. And if you look at the patterns, the vertical line, dotted line is pre-lockdown and post-lockdown is after that dotted line. And if you look at signatures in each cities have been different. And you would see what was also observed in the case of Delhi data, a sharp fall immediately, that you just move from the pre-lockdown to post-lockdown. However, the variations have different signatures, the way that they're doing. You see two pollutants here, particulate matter 10 and NOx. Both are traffic related, and no wonder you find, because after the lockdown, there was hardly any traffic on the streets. These two pollutants showing you a typical fall. But you also would see rise in some cases, particularly behavior of PM10, because that's not the only source. And it's an interesting case because you do have a movement of dust coming in from the desert areas, and that can interfere into interpretation about the behavior of the particulates during the lockdown. Next slide, please.
Yes, sir.
Similar patterns. I mean, this is the Delhi study which I talked about earlier. You would see again a vertical red line, which is pre-lockdown, and the post-lockdown is after that. An attempt is made here to do linear trending. That doesn't work because you would see that the R-square values are low. So there's not going to be a statistically significant linear trend either way, upward or down, but it nonetheless gives you a pattern, talks about that overall there is a tendency to show decrease in the levels of pollutants in different locations again of the city. Next slide, please. But it's very important when we interpret this data that we have to use a robust and quantitative analysis of the trends. Not just visualization, as you see many cases done, even in the case of the data published by Rajasthan Pollution Control Board. There are more other boards who have done that, but plain visualization doesn't help. And one can't do linear trending for this kind of a data. For example, if you did a rigorous statistical test on the data published in the state of Rajasthan, 1/3 of the stations do not have statistically significant downward trends. So we got to be careful, and we got to follow robust and quantitative trend assessment methodology. I'm just cautioning this point is because we have a rich data to analyze, and that deserves a better tool or better level of statistics to be applied to draw interpretations. Next slide, please. Well, let's come back to that satellite data processing. So here what we did was, again, we focused on Rajasthan, and then we used the source as the MODIS data. We had about a kilometer resolution. This was a free data which we used, and the aerosol optical depth was the variable which we chose. And one can choose different wavelengths. We took 470 nanometer as a wavelength to detect. And AOD is the indicator of particulate matter in the total column of the atmosphere, where the imageries are taken. And then we compared 2019 and 2020 and focused on the pre and the post period, when lockdown started. And the next slides, you could take, Professor, one by one. You don't have to stop. These are just flashes. You'll see AODs in 2019. And just look at the visual. It gives you an idea about the AOD values. It tells you, again, the basis for different months. These are all busy slides, but just to show you that the nature of AODs are different as we change the window. And that is something interesting. And this is an important slide that shows you, the distribution of the AODs during the lockdown period and pre-lockdown period, and the base year which we chose a year before of 2019. And what you see on the right-hand side of this slide is different districts of Rajasthan, and it's talking about the percent changes. So this is interesting, analytics one could use. But if you go next slide, please, it draws you some observations. So of course you see that the higher AOD values have become less frequent during the lockdown phase compared to the baseline in the pre-lockdown phase. Most of the districts show a reduction when compared to the earlier periods. But however, you will see that the base period, when you compare, the absolute AOD values are rising. That just shows in any case the particulate pollution is going higher. For example, Jaisalmer in Bikaner districts, they show higher AOD values, obviously due to scenarios coming from the desert sand suspension, which contributes a lot to the natural aerosols. So one could use even imageries in our cases also and do a fair amount of analysis, which is also useful as compared to the analysis just of the ground level based air quality monitoring stations. Next slide, please. And you could see the similar variations in other districts as well. So though the histogram which I was showing earlier of the AOD shows a general decline, there are factors other than the anthropogenic factors, natural deaths from deserts. They do play a role when we start interpreting such trends. Next slide. So I'm bringing close to the research and the interest of our chairman today, moderator today, and Professor Arun Sharma. And this is a question which comes in when we say, as we know, air pollution is known to weaken the immune systems. A lot of publications have appeared. There is a view that it, from the European Public Health Alliance, that it compromises people's abilities to fight off infection. So that's again an issue. What happens when the outdoor, I'm not talking about indoor, outdoor air pollution is of concern, especially of particulates. Next slide, please. So here is an example. I think we just skipped some slides. Can we go back?
Sir, this was the slide. And this is the next slide.
No, this is the one which you got. The next slide.
Yeah, yeah.
So I think there is
I haven't skipped any slides.
Right, I'm getting you, Professor. I'm just looking at my copy.
Okay.
Just give me a moment.
Sure, sir, sure.
We are fine, Professor. So we can
Okay,
continue. You are right on the spot there. So it's important that we look at the challenges post-COVID. Now, the first thing is we are going to see, I'm saying post in quotes because I don't know, Professor, whether we'll ever see this post word of COVID. Maybe we have to live with it. Now, the changes in lifestyles we expect, right? Many of us today are working from home, like what we're doing today, video-based meetings. The whole transportation element is going to change, for example.
Yeah.
Also, it's going to change the use, how much do we do of mechanical buildings. So less public transport in addition will be used. People may prefer to go back to private modes of transportation, which will go up. Some people speculate there could be even more sharp increase in the use of two-wheelers because people worried even while taking a taxi or driving car with companions. So it could well mean increase even in the two-wheelers. We are going to see a very high increase in the production and use of medical plastics and in general plastics. The speculations are that within a year we will cross 1.5 times, and next 5 years we'll see a 5-fold increase. And that is going to lead to a COVID contaminated plastic waste, which may have a route of incineration followed. And therefore, if you put everything together in terms of changes in the lifestyle, less preference going to the public transport, more production, remember, production of plastics, which is energy itself, and the incineration, which eventually we may have to follow, there is going to be an increase in the greenhouse gas emissions, which we all have to remember. It's a change going to be. Next slide, please. So if you compare this crisis, well, COVID-19 certainly is one of the biggest global crises after the war. But still, I would say it is dwarfed when compared to long-term risks posed by climate change. Unfortunately, not so many of us see that climate change is a much bigger threat. we do see lately surprise cyclones coming in now also from the Arabian Sea and so on and so forth. But the irony is that we know it is coming, but we seem to be still not convinced enough to act and be prepared for it. Shall I say COVID-19 pandemic is one global lesson, but still we haven't gone to think about what's standing beyond like a demon, I would say, the climate change. And not that we publish in the newspapers every day, like what we do today in terms of deaths and people recovering and so on and so forth. So the next slide, which you were showing just now, Professor, is a very interesting quote which has been made by Margaret Salomon.
Yes,
And
Priyanka.
she said that if we fully accepted that we were in a climate emergency, then every day the news would lead to updates about which countries are reducing their emissions, people clamoring to make sure that the leaders were adopting the policies and so on and so forth. The climate is still not that a subject of discussion that it deserves. We don't see that happen. Next slide, please. I'm ending here, Professor, but I would like to, bring upon your recent publication, which you did about this whole discussion, whether the effect of particulate matter, Harvard study, which talks about that it is going to spike up the rates, and this is the slide on that. No, just go back, Professor. Uh, the slide which you just flashed. Yeah, this one. So there's been a huge discussion, and this is a study which is talking about the COVID-19 mortality rates with air pollution. And these questions are coming up. And if you go to the next slide, Professor, this is a study coming from Italy. The next one, please. The particulate matter and COVID, that we just see a publication which appeared last month from Harvard University. And I think the opinions which we also see from Professor Sharma, which is questioning some of the hypotheses made there, and I like the title, Air Pollution and COVID-19 is the connect worth its weight. So I am going to end this presentation now, giving back again to Professor Sharma, and with a request that in his summing up, he clarifies what he's already said in his paper, which is COVID-19 Connect to the particulate matter. Thank you very much, all of you, for your attending and listening to me today. Thank you, SIE.
We'll be putting up the questions soon. So I'll request Professor Sharma to please put up the questions to the speaker.
Sorry, my microphone was off. So I'm sorry, I'm back online. I will be responding to Professor Modak's comment about my publication, and then I will be taking up the questions which are there on my screen. So the issue that was raised was about the Harvard School of Public Health's publication, a study. Actually, this study is a retrospective observation that if 20 years ago, the PM 2.5 concentration had been 1 microgram less than what it was at that time period, then the number of mortality due to COVID-19 USA that we are seeing today would have been less by 20%. Now, this is very important to understand in this perspective, that today, if we decrease the PM 2.5 concentration in the mainland USA by 1 microgram, it's not going to reduce the COVID-19 mortality by 20%, because the relationship between PM 2.5 level and COVID-19 mortality is an indirect one. That means the PM 2.5 concentration 20 years ago, which was present, caused comorbidities, that is diabetes, hypertension, coronary artery diseases. The population, because it was exposed to that level of PM 2.5 20 years ago, developed those diseases. And those are the comorbidities which increase the risk of mortality in if they are affected by COVID-19. So the change that occurred or could have occurred cannot be undone now, because that was the level of PM 2.5 20 years ago. And it's very important that the take-home message should be that yes, decreasing PM 2.5 levels may help, but that 1 microgram decrease, if it happens today, it's not going to affect the COVID-19 mortality. Professor Modak, this is what my observation is. So if you want to continue the discussion, let me know, or I will move on to the questions.
Please continue, Professor. And your publication, I have put in my slide the reference, but I think everybody should read what you have published, both the papers, which almost had a gap of 3 days or 4 days.
Yeah, one was a scientific publication coming out in a journal, and other publication was for common people, taking away the scientific part of it and converting into a communication for general population. That was the only difference between the two.
Yeah, yes, Professor. Yeah. So please carry on.
Now we have questions which will be taking. I'll be taking up one by one. I'm just coming to the questions and looking at the. So we have question from Mr. Siddharth Arora. This question is for Professor Modak. Looking at the positives in the environment that lockdown brought with it, do you think a planned weekly lockdown in the Indo-Gangetic belt can be suggestive measure during the peak pollution time? Professor Modak, please.
So Siddhartha, this is not the solution actually. You can't really come up with some interim lockdowns. It's like how shall I say, a very short-term approach. This is not going to work. It has these improvements in air quality. What you see during the lockdown are anyway we have found in unlocking period already the pollution's rising. In fact, some people are finding, in fact, a spike now, after the lockdown period is over. So we got to go to the fundamentals in terms of how do we look at our development paradigm once again, not as a development or environment, but again, as we say, development and environment together. We can't be impatient in terms of getting a speedy economic progress at this time. I think we do need a balanced approach. I'm not saying that don't go after not doing development, but I think we have now enough experience at how do you mainstream sustainability to the advantage of both developer, regulator, and people like us, the common citizens. So let us look at that middle course that we go around instead of looking at lockdowns as a solution to the problem of pollution, just the way we say that dilution is not the solution to the problem of pollution. Thank you, Siddharth.
Thank you, sir, for that information. That's very useful way of putting at it. Really, these are knee-jerk measures that we can go for a lockdown whenever we feel like, but that is not a permanent solution or not a sustainable solution. You cannot bring down the economy and the regular flow of work by bringing periodic lockdowns to address the issue of climate change. We have to go back to fundamentals. It's absolutely right, sir. And then we have a question from Mr. Shreyans. He wants to know, again, Professor Modak, from you, that how surface ozone is different from atmospheric ozone in context of health issues, and what concentration of surface ozone is permitted. Sir, you are muted. Please unmute yourself.
Yeah. Sorry.
Yes. Yeah,
so,
Shreyans,
the objectives or the functional role played by ozone in the upper atmosphere and in the ground levels are different. So what you see, it is playing a role in the upper atmosphere, which we know that it is playing an important role in the absorption and dissipation of the ultraviolet rays, the UV rays. And this has been one of the reasons that people did find that we had to go about reducing that accumulation of, increasing the accumulation or getting back to the ozone concentrations which we wanted through the Montreal Protocol and all these measures which we took in phasing out ozone depleting substances by the other substances has been the global effort to address that issue, which is where we really would like ozone not to get depleted. On the other hand, the byproduct generated at the ground level in the reactions between the sunlight, the nitrogen oxides, and the volatile organic carbon or VOCs, this production is not desirable. And I did put a slide to show that it does have serious health effects, and therefore we need to have a limitation in the concentration of ground level ozone. Now, there have been a number of standards which are setting limits to that value. And some of them are also window based, that is limiting the concentrations between 6 to 9 a.m. in the morning, when sun comes in, and so on and so forth. For that kind of a window of standards, the limit is 0.12 ppm, and that's the example how the standard has been set for specifically for certain windows of ozone. So this is an interesting case where we want the ozone not to be there and where we want the ozone to be there, with a difference that at different heights. Thank you, Shreyans.
Okay, then we have a question from Dr. Jagdish Godial. He wants to know why our attitudinal changes are not at all changing at an accelerated rate for the burgeoning challenges like climate change, road accidents, and deforestation.
Is it the question to me?
Yes, I think this is a question for both of you. If Professor Keber would like to answer that.
Yeah, that will be nice. Yeah.
Professor Paulo, are you there?
Yeah. Yes, I'm there. Please, could you repeat? Okay, I was looking at another thing. Please?
Yeah, no problem. Here, there's a question from Dr. Jagdish Godial. He is asking about why there is no change in our attitude at all regarding the accelerated rate of challenges like climate change and road accidents and deforestation. It's a question basically about changing human attitude.
No, in Italy, some change we have looked about this one, and we hope that people now will be also more attention to the environmental pollution. So now we are trying to learn about this situation, and I agree, it's very important also to put the attention to the climate change and to use this experience to see how important is, in particularly the traffic in Italy, in particular, to reduce it. So I hope that this dramatic situation will also help us to do some efficient solution also to the climate change.
Yeah, thank you. Professor Keber, I also have a question for you from Dr. Pratima Singh. She wants to know that is there any health risk for overuse of sanitizers? We are promoting use of sanitizers as a substitute for hand wash. So can there be a health risk from very frequent use of sanitizers, the alcohol-based sanitizers?
If you use correctly, no. So is the question of use them correctly, so not to abuse, but sure they have been produced and tested in order not to give a very important effect. So please use them, use with caution, but use them.
Right, sir. And one question we have again from Mr. Gyanesh Singh. Pollution increases after lockdown, but as pollution increases after lockdown, particulate matter will increase, which will reside in atmosphere at a certain period of time. COVID virus can get deposited in them and act as bioaerosols and remain airborne for longer duration. So what should be the approach in that situation to protect general pollution and tackle this spread? So this is the point that I have raised in my paper that Professor Modak has referred, that how much is the risk from pollution because of pollution from COVID virus. So Professor Modak, would you like to add something more to that?
No, not really. Not really. Your paper and your views actually explain.
Right. Thank you, sir. And then we have one last question from Aditi. She wants to know what might be the reason of increased surface ozone concentration post-COVID in China. Professor Modak, please. Sir, your mic is muted. Please unmute yourself.
Yeah. Sorry again. So the concentrations of the nitrogen oxides, as you have seen, they fall during the lockdown period, and they fell down because you don't really had emissions of the nitrogen oxides, mainly coming from the vehicular emissions. Now, nitrogen oxides are gobblers when it comes. Their higher concentration reduces the ozone level concentration because at the ground level, because there is a reaction in the presence of sunlight and the VOCs. But now that you have a lower concentration of nitrogen oxides, you would then therefore see a higher concentration of the ozone at the ground level. So that is the science behind it.
Right. So another question which lot of listeners want to be answered. I do not know whether this is the right forum, but the questions are asked about the quality of mask that is being recommended or being used, how effective that is in cutting down pollution or effect of pollution. Well, if Professor Kerer would like to answer that, I would appreciate it.
But it's a very, very complex question. We need a specific presentation to this. What I can say is that in the usual activities, the distance, at least 1 meter or better 2 meter, can be efficient. If you want to increase the protection, so the use of the surgical mask for both, for the people that are speaking, sure is very, very protective. Then in a special indoor environment where we have many people and this distance among the people is not, we are not able to do, so we can increase the protection, and in particular we can use the FFP2 or the N95 that are giving 94% of protection, so very, very high. Finally, in a very risky procedure, we can use the FFP3 that are giving 99% of protection. But these are just a part of the protection. I would like to underline that the first one is the at least 1-2 meters and don't have contact with among people. This is probably the more efficient way to be protected.
Thank you, sir. And to conclude from here, I want to talk about two important messages that emerged from the presentations by these world famous illustrious scientists who have joined us today, is that we are facing a double challenge. Before December 2019, when COVID had not arrived on the scene, air pollution and climate change occupied the discussion for a very long time across the planet. Suddenly, the narrative got shifted to COVID-19 post-December 2019. Now, that does not mean that the issue of climate change and pollution that the world is facing has become a secondary issue. And the matters have become more complex because they are interrelated. Climate change affected COVID-19. Lockdown improved the climate conditions, but we do not know how it changed the course of the COVID-19 infection in the country, or in the countries for that matter. Subsequently, we remember that there have been publications from Italy also that showed that in northern Italy, which is the more polluted area, which is the larger industrial area, the concentration of COVID-19 cases was more as compared to southern Italy. That means there is a strong interrelation between pollution and COVID-19. Of course, the direct mechanism may not be very clearly known to us, whether it is piggyback riding on the PM 2.5 or PM 10 particle, or it is some other indirect mechanism which relates air pollution to COVID-19. That still remains a matter of research, and the circumstances are very live at this moment when this research is progressing, and we may come out with some answer. But as Professor Modak rightly pointed out, that we cannot really brush aside the impacts of climate change and pollution over the world. The danger has not gone away. The danger has not become secondary by any means. So collectively, we need to think about both the challenges, COVID-19 as well as climate change and pollution simultaneously, and look for solutions which save the planet and the human citizens and the global citizens of every animal species from the serious impact of these mega problems that the world is facing. We all need to work collectively at the planetary level, at the government level, and of course with individual contributions from all conscientious people all over the world. Having said that, I think the discussion can go on and on, because the issues are very important and very questionable and people are anxious to know. But because of the time constraint, we have to close the session, and we can continue the dialogue beyond this through interchanges with ideas. I request all visitors to, all the attendees here, to visit the Society for Indoor Environment website, where you will find this particular webinar being uploaded, because we are recording it. It will be uploaded there, and the email IDs of both the presenters with their permission will be available, so we can continue with the dialogue later on this issue, because it cannot be solved in these 90 minutes that we have now. So I once again personally like to thank Professor Paulo Kerrer for joining us from a distance. The world is flat. We can see that on this flat world. We have people from Italy and other countries with us on this flat screen. And I'm also thankful to Professor Modak for these insightful comments and bringing out these important issues. However,